So in our organization at the University of Chicago, we actually incorporated choosing wisely into our annual operating plan as part of our quality mission. And so in doing so, we wanted to catalyze a way to engage frontline providers like residents and nurses and other clinicians to be involved with choosing wisely and come up with ideas for how to implement choosing wisely actually at the point of care. And so we launched a series of local Choosing Wisely challenges to get the best idea from the front line. And we've had engagement of over 100 clinicians submit ideas and come together to work on proposals. And one of the winners actually was called Flip the Patient for Discharge. And the idea that a lot of times patients who are going home often still have a Foley catheter in place, or they're still on telemetry, which are both targets of the Society of Hospital Medicine's Choosing Wisely campaign. And so led by a fellow, but working with our IT resources, we were able to embed sort of a passive reminder into the patient list, which is literally the list everybody uses every day to monitor their patients. And it's a simple check mark to say, does your patient have a Foley? Are they on telemetry? And this tackles the problem of what we call immaculate catheterization, which has been described as patients often have Foley catheters or they're on telemetry, but oftentimes the clinicians don't know. And so just by having these simple passive indicators, and if your patient happens to be on it, you can actually, in the electronic order, you can just link on the check and then go and discontinue the order. So it makes de-implementation easy. And so when I would be rounding, I could actually just look at my patient list and say to my resident, why does Mr. Smith still have a Foley, or why is this person on telemetry? And just with that simple, passive reminder in our electronic health record, we were able to reduce Foley catheter orders by 1/3 in our organization in 9 months, and actually also have a major reduction in telemetry. And so I do think that this was just one way of having trainees come up with ways to implement choosing wisely at the front line that had great impact.